Okay, so if you've been following the news, you've probably seen reports about COVID-19 cases
Yeah.
ticking up again here in Singapore.
Yeah, that's right.
Today, we want to kind of get behind those headlines. We're looking at the official updates, Ministry of Health, the new Communicable Diseases Agency, basically, what 2230 has reported.
Exactly. The idea is to understand what this recent increase really means, look at the data, and figure out the context. It's not just about the numbers themselves.
Right. What's the real significance? So let's dive in. Where do we start? The numbers, I guess.
Makes sense. So the latest figures for the week ending May 3rd estimate around 14,200 reported cases.
14,200, and that's up from about 11,100 the week before.
That's right. It's roughly a 28% increase, which, sounds like a lot.
It does catch your attention. And what about hospital numbers? Because that's often the key metric, isn't it?
It really is. Hospitalizations also went up from 102 to 133. So that's about a 30% rise there. But here's an interesting point. The number of people needing intensive care, the ICU patients, actually went down slightly, just from 3 to 2.
Oh, okay. So more people in hospital beds overall, but slightly fewer needing that critical level of care. That's an important nuance, isn't it?
It absolutely is.
Yeah.
It suggests that while more people are getting infected, maybe the overall severity leading to critical illness isn't climbing at the same rate. At least not yet.
So what's actually driving this wave? Is it some new scary variant we need to worry about?
Well, based on what the authorities are seeing, the main variants circulating are LF.7 and NB.1.8.
Right. Never heard of them specifically.
They're basically descendants of the JN.1 strain, which we have heard about.
Yeah.
And these two make up over 2/3 of the local cases right now.
Ah, JN1 descendants. Okay, that's key because didn't the recent vaccines target JN.1?
Exactly. The Pfizer, Moderna, and Novavax vaccines currently available are all formulated for JN.1, so theoretically there should be some protection offered by those.
Okay, so the tools are there, but then why the surge? What's the suspected reason?
The thinking is, and this lines up with what authorities often anticipate, it's largely down to waning immunity.
Right. People's protection from their last shot or infection is just naturally decreasing over time.
Precisely. Especially if it's been a while since their last booster, or perhaps they skipped one. This seems particularly relevant for the more vulnerable groups.
That makes sense. It's not necessarily a failure of the vaccine itself, but more about keeping that protection topped up.
Yeah, exactly. It's like any vaccine. Immunity fades. And these periodic waves, officials consider them sort of normal for COVID. Now it's endemic, like flu season,
Okay, that context helps. So what are the specific recommendations then, given the situation?
The main push is really encouraging booster shots for those at higher risk.
Who falls into that category again?
We're talking about people age 60 and over, anyone with chronic medical issues, folks living in elder care facilities, definitely healthcare workers, and also people who live with someone who's vulnerable.
And the timing for that booster?
The general guidance is about 1 year after your last dose. Seems to be the sweet spot they're aiming for.
Okay. And accessing these boosters? Still straightforward.
Yeah, it seems so. They're still free, still voluntary for anyone 6 months and up. You can get them at the healthier SGGP clinics and the poly clinics. Access doesn't seem to be the barrier.
Good to know. It's more about awareness and, well, actually getting it done.
Right. And beyond the vaccines, they're also reminding everyone about just basic good hygiene. Stuff we all know, but maybe got a bit relaxed about.
Like what? Covering coughs?
Exactly. Cover your coughs and sneezes. Maybe avoid really crowded places if you're feeling under the weather. And if you have symptoms, sore throat, runny nose, headache, fever, wearing a mask is still a good idea to protect others.
Simple stuff, but effective. So boiling it down, the key takeaway isn't necessarily widespread alarm.
No, not based on the current reports. The message seems to be more about informed awareness. Yes, cases are up and hospitalizations too, but the healthcare system isn't described as being overwhelmed.
And the public health response is seen as measured, proactive.
That's the description, yeah.
Yeah.
Measured and proactive. It really highlights that we're in a phase where individual choices and sort of community readiness play a huge part in managing things.
It really does bring it back to the individual, doesn't it? It makes you pause and think, okay, when was my last shot? Or, is there someone I know, maybe an older relative, who might be due for that booster?
Absolutely. It's that constant balance now, isn't it, between personal health decisions and how they ripple out into the community, especially as we navigate COVID being, well, just part of the landscape.
Definitely food for thought. How much are we focusing on those proactive steps versus just reacting when numbers rise? Something to consider.